So I went into Queen of the Snakes account. I went all the way back to her very first video in 2021. And I found one. But it's actual proof that she does have HAE.
Show yourself and show your medical condition.
Okay, so that's pretty classic symptoms of what our attacks look like if you are a facial sweller. Lips are probably one of the more common places. Hands, feet, lips. And it generally happens on one side of the body. So you'll have your right hand, right foot, right face, that side. It can happen on both. Unfortunately, being airway sweller, it happens circumferentially. So I don't have a one-sidedness. And the only other two types that I've had are abdominal swell. And I've only had about 5 of those. 3 I had to go to the hospital. And I've had now 4 dura mater swells, so brain swells. I am a primary 98% airway sweller, as was my family. So now that I know she has it, I'm going to say she does not have the erythema marginatum, though not all get it. But in type 3, it's pretty common. It's a non-raised, non-itchy, red, angular, like a linear rash, flushing almost, but it's Coke can red. Mine goes from cheeks to the middle of my chest, and it will wax and wane. It comes, it goes, it comes, it goes, it comes, and I can get it before I have an attack, about 30 minutes before, which is really handy. There are other symptoms you get with an attack. You just have to learn to be very in tune with your body. That's what I always tell people. You need to really microscopically think of anything that's happening, whatever you're feeling, hearing, seeing, anything on your body, in your body, because those can be clues. And it may be something that will tell you you're about to have an attack. Sometimes you don't get any warning and just boom, it's there. Now, what's also leading me to believe she's a type 2. Type 2 is the second most common. 85% of HAE patients have type 1, which typically is not swelling, but more of a rash type symptom, and it can often be mistaken for mast cell cascading, which is another disorder that unfortunately is a comorbidity of HAE. A lot of us have mast cell activation, and it's kind of a hard thing to test for. It's a hit and miss test, and it like the planets need to be aligned just right in order to get a positive. So you tend to see docs most often give you a slap a diagnosis on you based on your symptoms. I'm going to say she's a type 2 and she is acquired, but I need to delve and talk to her in her chat. There is a thing called acquired angioedema. It's not hereditary per se. It gets lumped in, but it's actually, instead of HAE, it is AAE. The thing that gets confusing is the organization is HAE. And in there, it'll tell you all the different types, and AAE is in there. So they sometimes will say they're an HAE patient. They're not. They are an AAE, which is the first person and the only person in the entire family that has it. It can happen. It's a genetic thing. It can happen. You have a mutated complement 4 or complement 1. The reason I'm saying it is her swelling is very localized, and generally it's a little bit bigger. It involves a little bit more of the face. When you have a full-blown HAE type 2, type 3, she does not discuss her meds, which means she is not on an infusion system at home. She doesn't have emergency injections. And also, she would not have to go to disability based on autism and BPD. Now, she does say she's bipolar as well. So maybe she's saying bipolar and misacronyming it by saying BPD, which is borderline personality disorder. Because, like I said, if you go, long ago, some doctor said to me, I was having trouble controlling my attacks. And I thought, oh shit, everything's gone. My career's gone, everything I've worked for. And he said, just go to this disability doctor and see what they say. And the minute I walk in with my notebook, my card, all my paperwork, because we have to keep notebooks on ourselves, there was no exam. He looked at the notebook. He looked at the labs. He asked me a couple questions, and he said, yeah, you've got it. Literally. And the doc can't say that. But he did. And kid you not, it was 6 days later, I got a notice in the mail. You're approved for federal disability. And I was like, I don't want it. I don't want it. I think I got $93, and I got it for 3 months, and I had to pay it back because I went back to work. I didn't want it. I needed time to get my attacks under control. The other thing is type 3 and some type 2s tend to be estrogen driven. Mine was. I would always, you could set your calendar to me. You knew when my period was coming because 3 days before it hit, I would have an attack. And which became kind of handy when, right before my hysterectomy, like 2 years before, because then I stopped having periods, TMI. But medically speaking, I was perimenopause, and so it was like all of a sudden, after being regular my entire life, I became irregular. So it was kind of handy for me. I would know because I would start swelling. My throat would start swelling. Like, oh, I guess I'm going to have a period this month. TMI. But we're discussing a medical condition. She went through pregnancy, which tends to be one of the hardest things for an HAE patient, a female, to go through. It can be attack after attack. You can be on a ventilator. It's not uncommon. The mother's life is definitely at risk if you're an estrogen driven. She doesn't discuss anything. She had no attacks during her entire pregnancy. She is not, this is and this girl has a huge Tic Tac presence, okay, for years and years and years. And HAE patients tend to document all their attacks because they try to share and make awareness videos. The majority. And this girl climbs on every bandwagon there is. She never once discusses it, talks about it, anything. So I'm going to say she's an acquired. And she's possibly a type 2. She may just be acquired. That's it. Because that is the only time that she shows herself being symptomatic. And you can have attacks at home. I have them frequently. You have them and they last 72 hours to a week, and it's just this waxing and waning. And you know when you need to go to the hospital. But sometimes you can ride it out. Sometimes you can use your infusions. But this was it. She wouldn't even have to mention autism. All she'd have to do is walk into a disability exam and say, I have hereditary angioedema. Here are the medical records. Period. Because it is fatal. It is, like I said, 12 members of my family died. Everybody has had it. Not everybody became symptomatic. Everybody has it. So I don't know what to tell you, but I got to figure this one out because now she's in my game. She's in my club. So something ain't. She might just have never had an advocate or a good doctor to explain to her what she has, and she needs to watch that baby. Because if she is hereditary, that baby has a 50% chance of having it. And it's very sad in children. So, I had my first attack at 2. So, it's very deadly for children. So, yeah, we got to get to the bottom of this one. So that's your update on the Snake Queen.